Welcome to Aetna Medicare Advantage. We measure our lives by the connections we make. That is why we take a total and connected approach to health. An approach that uses technology and data to help you manage your healthcare experience as you work with your doctors, pharmacists, and others involved on your path to better health. At Aetna Medicare, we put care all around you, connecting you right where you live to the hospitals and physicians you know and trust, connecting you in person to resources like transportation to doctor appointments, connecting you over the phone with care management or our 24-hour nurse hotline, connecting you online with telemedicine and Silver Sneakers fitness memberships with virtual access. Many of our plans also include extra benefits, like the Resources for Living program, dental, vision and hearing coverage, an over-the-counter product allowance, and so much more. We want to introduce you to some important information you need to know when considering a Medicare Advantage plan. We'll be providing information about various types of plans, so be sure to talk with your local representative to see which plan is the right fit for you. Let's begin with understanding Medicare. There are a few important terms you need to know to understand your Medicare coverage. A premium is a fixed monthly amount that pays for your insurance coverage. Your Part B premium is deducted from your Social Security check. However, if you sign up for different coverage options, you may be required to pay additional premiums. Your deductible is the amount you are responsible to pay for covered healthcare services before your insurance plan starts to pay. A copayment, also known as copay, is the amount you may have to pay as your share of the total cost for a medical service or supplies. This includes doctor visits, hospital outpatient visits, or prescription drugs. A copayment is a set amount, not a percentage. For example, you might pay $10 or $20 for a doctor's visit or a prescription drug. Coinsurance is an amount you may be required to pay as your share of the cost for services or prescription drugs. Coinsurance is usually a percentage, for example, 20%. If applicable, the copayment or coinsurance is paid after you reach your deductible. Medicare can be complicated. Let's simplify it by learning about the 4 parts of Medicare: A, B, C, and D. Government programs, or original Medicare, include Part A and Part B. Your hospital care covers things like inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. Part B is your medical care and may require a premium. It covers services from doctors and other healthcare providers, outpatient and home health care, durable medical equipment, and even some preventive services. Part C are private medical plans, sometimes referred to as Medicare Advantage, and are run by private insurance companies. These include Part A and Part B benefits and services as well. Some Part C plans include Medicare Part D, which is for prescription drug coverage. Enrolling in Part D gives you access to some extra benefits and services, like full or partial coverage for the cost of prescription drugs, and may help protect against higher costs in the future. Now let's learn about Medicare Advantage. Medicare Advantage is a lot like original Medicare, but with many more benefits. Medicare Advantage plans typically cover things that original Medicare, Parts A and B, doesn't, like dental, hearing, vision, and fitness memberships. Many insurance companies also combine prescription drug coverage, Medicare Part D, and medical coverage in their plans. At Aetna, we have a unique approach to health. We offer Medicare Advantage plans that connect you with the doctors, pharmacists, and health and wellness providers involved in your care to help ensure a more personalized approach to your health. We deliver a total and connected approach to health by using technology and data to help you manage your healthcare experience and make care more connected and personal for you, providing reminders and suggestions for medical appointments and other next steps to help you keep on a path to better health, using advanced data and tools to help members, helping members to find and access community health resources, helping members navigate the healthcare system, and creating a seamless health experience by connecting you to care in person, over the phone, or online. There are many types of Medicare Advantage plans. Let's learn about the 3 that Aetna may offer in your area. If you choose a Health Maintenance Organization plan, or HMO, you'll use doctors in the plan's network. You might need a referral to see a specialist. With a Health Maintenance Organization with a Point of Service Plan, or HMO-POS, you'll also use doctors in the plan's network. You may go out of the network for certain services, but often for a higher copay or coinsurance. And going out of network may require a referral from your primary care physician. A Preferred Provider Organization plan, or PPO, lets you use doctors and hospitals out of the plan's network, but often for a higher out-of-pocket cost. In most cases, you do not need a referral to see a specialist. Let's learn about Medicare Part D. There are a few important terms to know so that you can understand your prescription drug benefits. A formulary is a list of drugs covered by your plan. A tier is a group of drugs on a formulary. Each group or tier requires a different level of payment. You might see the groups listed as generic drugs, brand name drugs, or preferred brand name drugs. Higher tiers usually have higher cost sharing. For example, a drug on Tier 2 generally will cost more than a drug on Tier 1. Your network is made up by the pharmacy options you have for getting your prescription drug. You may get a one-time fill of a drug that isn't covered on the formulary. This is known as the transition process. It's important to understand the 4 stages of prescription drug coverage. Stage 1 is the deductible stage. You will be in this stage until you have reached your deductible. In this stage, you'll pay the full discounted costs of formulary drugs. Stage 2 is the initial coverage stage. After you have reached your deductible, you'll pay only part of the cost for your drugs in the form of a fixed amount. For example, $15. Stage 3 is called the coverage gap, or sometimes the donut hole. You'll enter this stage after your yearly drug cost reaches $4,130. In this stage, you'll pay a percentage of drug costs, for example, 10%. Stage 4 is catastrophic coverage. Once you're out of the coverage gap, you will only pay a small amount for covered drugs for the rest of the year. Now that we've covered the basics of prescription drug coverage, let us welcome you to an incredible pharmacy network. With over 65,000 pharmacies in our network, filling your prescriptions is convenient. And more than 23,500 offer preferred cost sharing to give you the lowest price possible for your drugs. Finding a network pharmacy near you is simple with our online network directory at www.aetnamedicare.com. We want you to pay the lowest possible price for your drugs. You'll typically pay less when you get your drugs at one of these retail pharmacies. With more than 23,500 preferred cost-sharing pharmacies, finding one is easy. Our network includes many local independent pharmacies, too. If your plan includes preferred pharmacies, you could get extra savings at these locations. The pharmacy networks may be different on our prescription drug plans. Ask a licensed Aetna agent to learn more about your Part D plan options. Remember these important formulary tips. It's important to be familiar with our formulary and check it when signing up for a new prescription. You can view our formularies at www.aetnamedicare.com. Keep in mind, sometimes formularies can change. For the latest information, visit our website or call us 24/7 at 1-855-338-7027, TTY 711 to get help with your formulary. There are a few more things you may need to know. Your plan may also have these drug coverage rules. Prior authorization. Some drugs require prior authorization. Your doctor must first show a medical need for you to use the drug before the plan will cover it. Quantity limits. These place a limit on how much you can get at one time. Step therapy. You must first try another drug on the plan's formulary before you can move up a step to a higher tier drug. To get more information about the drug coverage rules for your specific plan, you can view your drug list, also known as the formulary, at aetnamedicare.com/formulary. You may qualify for help with your Medicare drug costs if you have limited income and resources. Extra Help is a Medicare program that helps pay some Medicare prescription drug costs like monthly plan premium, yearly deductible, coinsurance, copays, coverage gap. To see if you qualify for extra help, call 1-800-MEDICARE 24 hours a day, 7 days a week. Call or visit your Social Security office or state Medicaid office, or visit Medicare.gov. One way to get extra help is through an Aetna D-SNP. Do you have both Medicare and Medicaid? If so, you could qualify for a dual-eligible special needs plans, or D-SNPs. D-SNPs are specialized Medicare Advantage plans created for those who qualify for both Medicare and Medicaid. With a D-SNP, you could get extra benefits that go beyond original Medicare. Talk with your broker to see if you qualify for an Aetna D-SNP. Now that you understand Medicare, it's time to sign up. Generally speaking, you can only enroll in Medicare Advantage during specific times of the year. The main enrollment time is the Annual Enrollment Period, AEP. This is when anyone can enroll in or disenroll from a Medicare plan. AEP runs from October 15 to December 7 each year. Coverage then begins January 1 of the following year. The Initial Enrollment Period, IEP, is the 7-month period that begins 3 months before you turn 65. It also includes the month you turn 65 and ends 3 months after the month you turn 65. However, this timing could be different if your birthday is the first of the month. Please visit Medicare.gov for more details. You have the option to download an enrollment kit. Inside you should find an Informed Choices section that explains everything you need to know before choosing your plan, a Back to Basics section that explains the basics of Medicare. The A Closer Look section provides a summary of your benefits. You can use this summary to get a general understanding of your coverage and responsibilities. It explains in general terms what a line of health Aetna covers and what you will need to pay for. Keep in mind, the summary of benefits doesn't list every service or every exclusion. For specific information, please refer to the plan's evidence of coverage. Learn about Medicare star ratings in the Star Ratings section. Finally, a Rock Enrollment section to help you get started with your enrollment. Medicare star ratings let you know about a plan's quality. Each year, Medicare rates all health and prescription drug plans based on a 5-star quality rating system. The Centers for Medicare and Medicaid Services, CMS, rates plans on a scale of 1 to 5 stars, with 5 stars being the highest quality. They use information from member satisfaction surveys, health plans, and healthcare providers to give overall performance star ratings to plans. CMS star ratings can help you compare plans based on quality and performance. You can find Aetna Plan star ratings in your area by visiting our site online. Once you're a plan member, you'll get your ID card and occasional letters or phone calls from us and our partners. On the front of your member ID card, you can see your plan and ID numbers, which you'll need to provide to your doctor. On the bottom left will be the contact information for your primary care physician, or PCP. On the bottom right is your contract PBP number, which you will need whenever you are using our online tools. You can also easily find important numbers for customer service and the 24/7 nurse line on the back of the card. Now that you know more about your different Medicare plan options, it's time to get more information about the specific plans available to you. Aetna has the resources you need to help answer your questions. At Aetna, we're bringing care right to you because that's how you make healthier easier. We're putting you at the center of your care, creating a seamless health experience that takes care of the whole you, body, mind, and spirit, so that each and every day you get the answers, the support, the care you need when you need it. Because when a health plan really shows up, when it is there for you every minute of every day, you begin to feel truly cared for. And that results in confidence, the confidence to age actively, to greet each day with more energy, more optimism, to start thinking less about how to stay healthy and more about the life you love. We measure our lives by the connections we make. Aetna Medicare Advantage.